Good morning, ladies and gentlemen. On behalf of Abu Dhabi Public Healthcare Center, allow me to extend a warm welcome to you. Let me briefly introduce myself. My name is Mariam Al-Mansouri, and I'm delighted to be here today to talk to you about Abu Dhabi health programs. I will start with overview about Abu Dhabi Healthcare Center, and then I'm going to move to describe more about our initiatives and 2021 programs. I would like to give you some background information about the current situation in the Emirate of Abu Dhabi. As a country, the United Arab Emirates has developed very rapidly from a developing country with a largely nomadic population to a modern and wealthy country with a Western lifestyle. This economic progress has brought to social benefits and opportunities for UAE citizens, including a high and increasing life expectancy. However, rapid modernization and urbanization have contributed to significant problems with chronic diseases, particularly obesity-related and cardiovascular risks. Rates of obesity are increasing in children in the UAE. Children who are obese are far more likely to have abnormal weights as adults. This is a major risk for cardiovascular disease. Food is central to health, whether it is the role of food and nutrition plays in development, providing energy for day-to-day activities, or reducing the risk of many chronic diseases. It touches every moment of every day equally. When we are not following healthy eating, we are at risk of chronic illnesses. Therefore, I would like to announce to you that Abu Dhabi Public Healthcare Center launched in 2019. Next slide, please. Next slide. Abu Dhabi Public Healthcare Center is working in developing healthcare programs, healthcare initiatives that's going to improve the quality of care and quality of lifestyle in the Emirate of Abu Dhabi. We work hard to collect data, to work on surveys, and to make sure that we are in contact with private sectors and other stakeholders as well. Our health eating strategy is designed to improve the food environment in Abu Dhabi and make it easier for the people to make the healthier choice. The center helps maintain and improve the citizen health by promoting healthy food choices, and we would like today to highlight how we are promoting healthy eating as well. Next slide. Our initiatives to be healthy Abu Dhabi is launched in cooperation with public and private sectors as well. The strategy, which aims to improve nutritional intake and reduce the consumption of unhealthy food, elements achieving these objectives will reduce diet-related diseases and health issues. The initiative implementation will raise the awareness of the community, enhance public health, and boost the competitiveness of locally produced foods. Our policies, standards, regulations, and guidelines are grounded in scientific evidence. We conduct research and keep up with the latest findings on nutrition, to ensure that our work reflects the strongest evidence, recognizing the global nature of nutrition evidence and the food system. We also work closely with our partners inside and outside Abu Dhabi to share information and to set the international standard. We aim that our nutrition programs and initiatives will help all Abu Dhabi citizens as well. Next slide, please. There is different types of policies when it comes to interventions. Government can use a spectrum of policies from voluntary to mandatory. By their nature, public health concerns such as nutrition are multifactorial. Even single or simple interventions induce effects within complex web of interactions. We focus on policies directly targeting nutrition rather than more indirect mechanisms, help making healthy eating the easier choice. Next slide, please. Why we choose CIAL? We believe CIAL is the best platform for us to market our programs, to introduce our programs in the Emirates of Abu Dhabi. As Abu Dhabi Public Healthcare Center, we cannot work by ourselves. We need our partner and stakeholders when it comes to groceries, supermarkets, investors, food manufacturers as well, plus restaurants. All of you today are here, and we would like to welcome you and would like to hear about you and to learn and get more experience. We are looking to have more new products, innovative approaches, and would like to bloom Abu Dhabi market with the new healthy foods. Next, please. Next. Today we're going to target certain audience. Our main target with CIAL workshops, and I would like to invite you to attend our rest 4 workshops. I would like to invite bakeries, restaurants, food outlets, factories, investors, groceries, and supermarkets. Please make sure to attend these training workshops, introductory workshops that will help you to learn more and will tell you how to be part of our programs. Next. Our new initiatives in 2021 is displaying calories in the menu. We would like to invite today 9,000 restaurants located in the Emirate of Abu Dhabi to join our workshop today to learn more how to be part of these initiatives that is led by Abu Dhabi Public Healthcare Center. Next. As well, we would like to invite all Abu Dhabi groceries, supermarkets, and hypermarkets. They are around 4,000 outlets over there. Please make sure to do not miss our healthy groceries workshop today. Next. As well as we'd like to introduce you and let you know more about Wiqaya food labeling program as well, which will be discussed in other workshop as well today. Next. We would like to invite all bakeries in Abu Dhabi, 500 automatic bakeries. Please do not miss our lowering salt and bread workshop and initiatives. It's a new initiative as well, and we'll be very grateful to see you in the workshop. In conclusion, we are looking to have a brilliant restaurants, a brilliant food business to work together with us today. As well, we'd like to see a more flourishment and a more boost in Abu Dhabi market when it comes to the food sector investment, where all people achieve health and wellness action. Please, we'd like to thank you for your patience. We'd like to thank you for attending our workshops today, and feel free to ask your questions. Thank you. We'll leave the rest of the time for your questions and answers. This is the first. Excuse me 1 second. We're having some echo here. Just put it. Yeah. So this is actually the first SIA that we're having it virtual because of the health situation now, as we all know. And before we had it since 2013. It used to be in ADNIC, a big exhibition where we were interacting with you, interacting with all the buyers and the government and our colleagues from restaurants, food outlets. And now I hope that we'll be interacting virtually, and we have done a lot of meetings, a lot of work virtually, and we would like this also to be a platform for you to ask your questions if you have any queries, and if you have any concerns, this is probably the time to raise it. I will be speaking today about Wiqaya program, and I am sure that many of you are familiar with it. But before I'm going to start, I'll introduce myself quickly for you who don't know me. My name is Arwa Al-Mudwahi. I'm a physician by training, and I have a Master of Public Health from UC Berkeley with emphasis on nutrition. And I've been working for the Department of Health since 2008. And as Ms. Maryam mentioned earlier, that now we are Abu Dhabi Public Health Center since 2019. And I'm very pleased to be actually working with the center. And now I'm with the Community Health Department. So please, can we start the presentation? I'm just waiting for my slides to... Yeah, so I will be talking today, as I mentioned, about Wiqaya food specifications. Next slide, please. So we all know that healthy eating habits can actually prevent the major burden of diseases. So what do we do in public health actually? In public health, what we do, we measure the morbidity and we measure the mortality. What I mean by morbidity is like the major causes of diseases. What is causing the major rates of death? What is causing diseases? And unfortunately, chronic conditions come as number one, including heart disease, diabetes, hypertension, and obesity. Obesity can lead also to other side effects. So how do we combat that? How do we combat chronic conditions? We have several things that we are actually doing, and the Department of Health doing, the health sector is doing, but also there is a major part that we can help you achieve, which is actually maintaining a healthy lifestyle. And one of the main pillars of a healthy lifestyle is healthy eating. And with healthy eating, we can prevent type 2 diabetes, we can prevent cardiovascular diseases, among others. And why type 2, not type 1? Because we know that type 1 is mainly comes with children, and it affects the pancreas, and there is not much, unfortunately, that can be done other than taking the medications and leading also a healthy lifestyle. But type 2 diabetes, actually, it can be even cured with a healthy lifestyle, with following a healthy diet, eating the healthy food, and exercising. It can even be cured. So it is that essential, actually, to follow a healthy lifestyle for people who have type 2 diabetes, who have dyslipidemia, have hypertension, and so on. So as you can see here, this is actually done by the World Health Organization. It is an old slide, as you can see. It says 2005, but this doesn't mean that it is actually not the same. It's still the same. And we have risk factors. We have risk factors that modifiable, and we have unmodifiable risk factors. What I mean by the unmodifiable risk factors is the environment that you are in. You can't change the environment. You can't change your sex if you are male or female. You can't, unfortunately, change your age. I wish we can go back a few years and be younger, but we can't change that. And we can't change our genes, as I said. But if there are things that we can change, then let's work on them. And what I mean by things that we can change our diet, eat a healthier food, we can be more physically active. The recommendation is to be active between 30 to 60 minutes a day, 5 days a week, and for children, even 1 hour a day. And of course, we don't want to exert ourselves, but if we do like 30 to 1 hour, this will. And by doing that, by following the
those, we will be able to actually work on our blood pressure. We know that salt, my colleague Rowan Mar'in, she will be talking to you about the importance of reducing salt in our food, because this helps with the blood pressure. We can work on our diet to improve our sugar levels, reduce the insulin, because high insulin also can have major side effects as well in the body, and the abnormal lipids as well. So this we can fight overweight and obesity. And with that, as I mentioned in the beginning, that the chronic diseases are actually the major risk factors. So with that, we can prevent stroke, hopefully, some kind of cancer. I'll give you an example of a very proven cancer that can be prevented, which is colon cancer. Colon cancer, for people who are not eating enough fibers and not watching their diet, it can be high risk. So we have to have anywhere between 20 to 30 grams of fiber a day. For males, it's higher. For females, it's a little lower. But we need to concentrate on food that is high in fiber to prevent those kind of cancer. Even there are studies that show that there is some relation actually with cancer and breast cancer and other types of cancer. And as I mentioned, diabetes, now chronic respiratory diseases, it's mainly the environment and smoking. And our colleagues at the Abu Dhabi Public Health Center are working hard on tobacco use and to prevent smoking from all kind of smoke to be able to control the respiratory diseases. Okay, so now my concentration today will be about, can you go back to, sorry, the slides are moving by themselves. Yeah, yes, this one. So we need to work about the slide, yes, about wiqaya food specifications. So what are wiqaya food specifications? Actually, what it is, those are specifications that we look at international evidence, and we look at what kind of food, what kind of ingredients within the food, that we rank them, we classify them, and see what is the nutritional composition of it and how is it actually related to health. So the major thing is the relation between food and health that we are looking at. And certain diets are determined by things, actually the nutrients and other nutrients quality as well. So even like now, today we're going to talk about wiqaya, about what is in the food, but there are other determinants in the nutrient quality that can affect our health as well. So wiqaya is only concerned with nutrients. It doesn't look at sustainability, it doesn't look at price, it doesn't look at environment. So maybe those will be, I would say, the cons. But the pros of it is that it does look at the nutrition composition of the food. So wiqaya specification development is actually it's identifying nutrition-related public health problems. So as I mentioned, we look at what is the major health problems, and we establish that it is hypertension, it is obesity, and it is actually dyslipidemia. So that's why we look at the calories, and I'm going to go into more details. We look at the fat content, we look at the salt, at the sugar content, and we look at how these nutrient recommendations actually how they are related to the food-based dietary guideline. Now, each country in the world have its own food-based dietary guideline. And our colleagues in the Ministry of Health now started establishing the food-based dietary guideline for the United Arab Emirates, and we are working with them, and we are, giving our input as well. So the other thing about wiqaya, it's identified possible intervention. And also, it is very important that when we start any project, it doesn't have to be just this one, is to convene a project group. A group actually that has people from the government entity, it has nutritionists, it has people from the public and the private sector. Now, when we started with wiqaya, we actually looked at different models. We looked at other examples. Wiqaya is not specific just for the UAE or for Abu Dhabi. Wiqaya it's all over, actually. When we looked at it, we did our research, we found out that you can find similar programs in other countries. Like, for example, in the US, they use the heart check program. In the UK, they use the traffic light system. In Australia, they also use what they call the check, and they use in the Netherlands, Scandinavian countries, they use the keyhole symbol. One interesting thing about the keyhole symbol, if you see the circle and you see the pyramid, this comes from, because we know that years ago we used to look at the pyramid and then we use the plate, and that's where the keyhole symbol is coming from. So now I'm going to concentrate a little bit about the keyhole symbol, because actually Can we go to the previous slides, please? After this one. Yes, why am I looking at it? Because we discovered that it has very much similarities to the wiqaya in terms of the specifications, how much fat, how much salt, how much sugar, etc. And when was that established, though? This was established years ago, way before we started, way before, not me, but some of my colleagues were even born. And this is in 1989. And so it's been a while there. And as you can see from the next slide, because it's been around for a long time, see how many products there are. There are like 2,500 products. There are in Sweden, there are around 600 in the Denmark and Norway. Restaurants have it, kitchen have it, and awareness also shows like almost 95% of people are aware of this program. So if you go to Sweden and you go to any supermarket, you will see the keyhole symbol all over the place. You will see it on healthy food items, on a Better Choice drinks, Better Choice milk. You will see it even in the delis, on sandwiches, fruits and vegetables, and so on. So now we are going to talk about our program, which is wiqaya. Please note that, yeah. Yes, so wiqaya is part of services. Wiqaya started in 2007 as a services, actually, that it was part of the health insurance thiqa, where it did a lot of testing in hospitals, and it was covered for nationals to find out what are the major health risk programs. And then it grew, it became also part of smoking cessation, and then it grew, it became part of food. So now for food, wiqaya allow all restaurants, food manufacturers, producers, supermarkets, that they can add this logo that you can see up there, that is like the word wiqaya. And wiqaya, for you who don't speak Arabic, means prevention. And there's a say by Prophet Muhammad, peace be upon him, that prevention is better than cure. And that's why we're using this word wiqaya, and the green heart that circles, that shows that it actually prevents heart diseases. So different nutrients are combined, and actually, as you can see, we identified foods and what's a better choice food, like if it's a low in fat and if it's less salt, less sugar. And the other thing, it is voluntary, but only in food outlets like restaurants, groceries, and so on. But when it comes to healthcare facilities, and I will be explaining more, so for you, please, those who are working at healthcare facilities, it is a mandate to have wiqaya. And also it covers prepackaged foods and menus as well. So what is a meal? A meal, as you all know, it has a main component, it has a secondary component, it has the siding. All of this need to apply the wiqaya specifications in them, as well as if like you go to a restaurant, you will see a buffet. It could be a salad buffet, also like a salad, because we know that salads are healthy. And as long as the dressing, because with salads we have a problem with dressings usually, as long as the dressing fulfill the requirements of wiqaya, then in that case it can carry the symbol. Okay, so what do we require from you? If you are a restaurant, if you are here with us attending, you need to have at least one wiqaya in each category. What I mean, one wiqaya in each category. Like if you have an appetizer, one of the appetizers should be wiqaya, a main dish should be wiqaya, a side dish should be wiqaya, and also a dessert. Usually in cases of desserts, it can be, I would say, like fruit salad. But also you can, yesterday we had a meeting actually with food outlets, and they are telling us how they can invent healthy stuff. They can do, like they were talking about Hollandaise sauce and how they can change the butter into another ingredient. And this actually will help in making it a wiqaya item. The same thing when it comes to dessert. Dessert, like if you have, for example, mahalabiyya, that's made with skimmed milk or low-fat milk. It's made with the healthy, not the sugar, but it can be like added monk fruit, or it can be wiqaya. And also date cake, for example. All this, we can work on them. Now, this is in terms of dealing with the meals. The other thing that the staff and the chef, they should be provided with training. Like if you are carrying a food looking after a food establishment, please make sure that you do training to your staff. We were happy to do the training for you. We have workshops, 3 to 4 workshops every year, so you are always invited to attend. And also, one of the main things that you need to train your staff on is doing nutrition analysis of menus and recipes. And now we used to use a lot. There are a lot over there on the web. Some of them you have to pay for, some of them are for free. There's Calorie King. I used a la carte for years, actually, before we developed our own food analysis program. And we invite you all to use it. It's offered to you for free. You don't have to pay. And at the same time, once you analyze your food through our food analysis program, it will tell us that you are actually registered with us, you are a Wiqaya entity, and we can look at it and tell you what are the changes that you can do to make it a healthy food options. And the other thing, that there must be a nutrition fact label. A nutrition fact label is a must. If you cannot have it on the food product, it should be available upon request. Like it is the right of the customer to ask you what is in my food, and you must have this available for them. And also there will be auditing, random audits. So it is very important that you keep a record, because you will be asked, if this is a Wiqaya, show us how is it a Wiqaya, what do you have in it, or what is the program that are using to analyze it to make sure that it is a Wiqaya. Now, here, let's go to the criteria. The criteria, as I mentioned, we look at obesity, so calories is very important. A main meal should be less than 700 kilocalories. A side dish should be less than 200. Fat should be less than 3 grams of fat per 100 grams. Saturated fat less than 1 gram. Sugar less than 3. Now, actually, we even made it more rigid with sugars, and we're asking to be less than 2 grams per 100 gram of products. And salt less than 0.8 gram per 100 gram. And it shouldn't be added to any food that is have sweeteners or have additives or is deep fried. This is very important that you keep in mind. Now, we have criteria for meals, and we have criteria for individual foods. Individual foods, it can be applied to dairy products. And if you're interested, please send us, shoot us an email, call us. You will have all our information on CIAL site. You have our social media information. You can ask us about the individual food specifications, and we will be more than happy to share them with you. So they are low-fat dairy products. Bread should be minimum 5 grams per 100 gram dietary. And I told you earlier the importance of having fiber in our food. Sugar, we are more flexible with the sugar when it comes to individual items than when it comes to the whole meal. So I said that it should be for a meal less than 2 grams, but when it comes to bread, we accept less than 5 grams. Sodium, it should be 0.5 gram per 100 gram of products. And my friend will speak more about the bread and the salt in bread later. Now, when it comes to pasta, cereal, we care a lot about having our fibers in those foods, so it should be 50% whole grains. Cereals, now, the other thing that we usually educate the community, and we want you to be our advocates for it, that sugar, avoid sugary cereals. And if you are the producers of those cereals, make sure that you work with your formulas and you have less sugars in your cereals. The other acceptable item, and a very healthy item, is vegetable juices. Now, this is something that I would like to mention, that fruit juices are not wiqaya. Because fruit juices, no matter how healthy they can be, they have a lot of calories, they have a lot of sugar because they are condensed. But still, I can't say that they are a bad option. If someone doesn't have diabetes, that doesn't have a problem, and can consume those drinks, those fresh juices, of course they can. But we have smoothies. Smoothies can be wiqaya as long as they have a vegetable in it, they have a low-fat dairy in it, and they have a little amount of fruits, which means, which translates to little amount of sugar. Why are we doing all this? We're doing all this because we have a population goal. We want to make sure that our population eat at least 440 grams per day of fruits and vegetables. As I mentioned, they need to have their fibers. Their fat should be less than 33% of their total energy intake, saturated fat less than 10%, and salt less than 6 grams per person. So what contributes to healthful diets if you are in the food industry, or if you are a mom, or if you are a dad, anyone who wants to follow a healthy lifestyle? please concentrate on your fruits and vegetables. Make sure that you're having enough whole grains. If you go to dairy, choose the low-fat options. And fish is very important. Twice a week, fish has very healthy fats. Even with the wiqaya, actually, we exempt fish from the fat content because we know, like, for example, salmon. Salmon has vitamin D in it, has a lot of antioxidants effect, has omega-3, and it is very, very beneficial for health. So when it comes to salmon, we do exempt the amount of fat, and please make sure that you consume fish at least twice a week. And if you eat your meat, make sure it's lean meat. If you have your chicken, make sure it's lean chicken. And also, don't always try to get your protein from meat or from chicken or from fish. Look at beans, at vegetarian sources of, luckily our Middle Eastern diet is filled with hummus, it's filled with fool, with all those things that do have a protein in them and have fibers as well. So they're definitely very beneficial. Now, what is the reference amount? When you want to look at all these things that I've been talking about, how do you look at it? Do you look at it in the dish? Do you look at it in portion? Do you look at it in grams? Actually, usually, and this is the international standard, this is what we usually do, we look at it per 100 gram of the product. Some people look at it per portion, but very, very rarely that you look at it for the whole pack. So that's very rare that it happens. And in public health, that can happen if we don't monitor it. Nothing happens without monitoring and evaluation. Consider it not done, unfortunately. So it's the same thing for your entity. You want to make sure that you monitor your work, you want to make sure you evaluate your work, and you want to make sure that awareness is always there. Why you're doing this, why not? What are things that are happening? Why are they happening? How you can treat them? How is the counter effect of those things? And so it's very, very important. The objective analysis that covers necessities, all of that is extremely important. Now, those are examples of our food outlets. We started in 2013 with 9 food outlets. Those are our pilot. As I said, monitoring and evaluation is very important. We worked with our partners at ADPHC at the time. Now it is the Agriculture Authority, and we worked with the Quality Conformity Council. And with those 9 food outlets, and we launched it on the 23rd of September 2013. And they came and they did a big feast at the Department of Health, where they showed their work, where they showed the nice food items that they were working on to make it wiqaya, and it showed very, very successful. Based on that, the program grew. In 2018, we have 30 outlets. And in 2019, we have 49 entities by last year. So this is a big increase. We have hotels, we have catering, we have restaurants, cafes, and we have hospitals. As I said, for hospitals, we're expecting the numbers to grow dramatically because it is a mandate. In 2018, there was a circular that was issued by the Department of Health that it is mandated by all healthcare facilities, their affiliated restaurants, food outlets, any food outlets that work for a healthcare facility must actually have wiqaya food items. Those are the names of the food outlets, and we will put their names. Like if you are a wiqaya, this is one of the incentives for you, that your name will be listed on our Abu Dhabi Public Health Center website. And this will be a great incentive for you, actually, because people will know more about you. We can even link it to your address. We can even have your contact information. So please, if you're not registered yet with us, register, and we will add you to the list, and we will add you to our website. Those are examples of healthy wiqaya menus. As you can see, we had the first healthy shawarma in the Middle East. And so here's how they advertise for it: get happy with shawarma. And we compared the healthy with the unhealthy, and how it was less fat, how it was less salt. And so it was a very big hit at the time. And the same restaurant actually that offered the shawarma offered a super healthy grain salad. So even people, if they didn't want to have the meat, they could have the grain salad. And there are many other restaurants that, as you can see here, their menus, how they advertise for it. We have La Brioche, for example. They had a beautiful social media clip, and this is a screenshot from it that they showed that they are offering the healthy food items at La Brioche. This is from An-Noor Hospital at the time. Now it's Mediclinic, and it is one of our pioneers actually who started this program with us. And I want to thank Amani Kamal, if I don't know if she's with us now watching, but she was actually one of our ambassadors at Noor at the hospital at the time, and she done tremendous job in making sure that all the food items within the kitchen, within the cafeteria, that's offered to staff, offered to patients. And when I say patient, I'm speaking later about what is the importance when I talk about patients and when is it related or not. This is at Al Mafraq Hospital. Also, I want to thank Batul, the dietitian at Al Mafraq, who also was one of our major pioneers who worked tremendously. As you can see, they even had like a whole section, and they had the sign Waqaya above it, a whole part of their cafeteria that had only Waqaya food. What did they do at Al Mafraq? This is, they trained their staff, they did a lot of analysis, they even did tasting to their food, they did awareness, customer awareness, they did evaluation, and based on that, they were able to establish their Waqaya program. And this is from Fairmont Hotel. Fairmont Hotel, there was a great chef. Unfortunately, he had to leave Abu Dhabi. He went to, I think, to Saudi Arabia, where I'm sure he's implementing the same great work that he have done there. And as you can see, the Frankie's restaurant at the time, the whole restaurant had, all what it had was Waqaya food. This is from Royal Catering. Royal Catering, they went with traffic light analysis, and as you can see here, their food items were either green or orange, which means that they satisfied Waqaya or they were very close to be Waqaya. That's when it's orange, but none was red at the time. So they really, Pamela, the name of the dietitian who was working with them, and she was amazing as well. This is La Brioche, as I mentioned. This is the advertisement that they had for Waqaya. And now I said I'm going to talk about healthcare facilities. I hope that some of you are from the healthcare facilities watching. It is very important to know that it is a mandate. The circular came out in 2016, and it was voluntary at the time. Unfortunately, when it's not mandatory, it doesn't happen the way we want it to happen. So in 2018, our directors, our management, their excellencies, they advised us that make it mandatory. So we did send a circular to all healthcare facilities that it is a mandate that they have Waqaya at the hospitals. So, but at the same time, we didn't want to constrain them too much because they must have their challenges, they must have their issues. So we decided, okay, you can have 70% of the dishes Waqaya and 30% are flexible. The same, I'm not going to go into the specifications again because it is the same specifications when it comes to the main dish, as I said, less than 700, side dish less than 250. I said I'm not going to go through it, so I'm going to keep my promise. But actually, those I can send them to you later if you are interested. Individual food, the same. Like if you're selling milk at the healthcare facility, if you have like a little, let's say, what do they call it? Like a little fridge with all these items, you just want to make sure that they match the Waqaya logo. Even vending machines must have the Waqaya food in them. 70% of the items must be Waqaya. Lebni, breakfast cereals, all of those can be sold in a vending machine. And why not? They can definitely meet the Waqaya specifications. The same with the meat, with the vegetables, nuts. Now with nuts is a very healthy food item, but it is very high in calories. 1 cup of nuts can exceed 700 kilocalories, especially if it's macadamia or those kind of nuts can reach even 800 or 900. So it's very important that the amount of nuts is limited, like 30 grams, no more than that. They say to make it easier for the customers, like size of the palm. And just make sure that there's no salt added, and it's not fried, and it's just like raw or maybe roasted without any oils added. When we say healthcare facilities, we mean everything. We mean the cafe, the cafeteria, the vending machine, and everything that is affiliated. Can you imagine that someone is smoking now those days at the healthcare facilities? When the anti-smoking initiative started, people thought, oh my God, this is not going to happen. But now it is just people, we will never it will look so awkward if you see someone smoking at a healthcare facility. It is the same thing. when it comes to healthy food, we want to make sure that no one is eating unhealthy. I don't want to name food. I don't want to give them a label, but we know what unhealthy food is, and we don't want to see that at a healthcare facility, because it's not good for your image. If you are a healthcare facility, it's not good for the customers, it's not good for the patients. We want you to be the advertisement. You are a hospital, so you want to make sure that you are advertising for the healthy food. So there are foods that are not allowed at all. And not within the 30%. I mentioned that you have a layer of 30%, but not when it comes to deep fried fruits, food. It doesn't not apply to beverages, the fizzy drinks, energy drinks. It doesn't apply to donuts, Danish, candies, all of those, they are not allowed. Regardless, we can't even say they are allowed within 30%. But you can have meats if they specify certain criteria. You can have a popcorn if like the sugar is less than 15 grams per 200, and also if the calories per serving per 3 cups is 200 calories. If you don't have added salt to it, and if you have the healthy oil, not the trans oils that's filled with trans fat or the saturated oils within the popcorn, then yes, you can have it. Now, portion control is very important, and I said 30%. What do I mean by the 30%? 30%, it can be like, let's say, biryani. A biryani, like you have the healthy biryani within your 70%, but then within the 30%, if you have like a little bit extra of salt, a little bit extra of fat, we can allow it within 30%. So it should be the little portion, not the big portion. And the other thing also, trans fat is not allowed at all though. Like you can have it, but without trans fats. And if you use carbs, it has to be whole grain. Now, you can have these items because we all crave sweets. And if someone is healthy, every once in a while, they can have a little piece of cake, they can have a cookie, but those with limits. So within the 30%, you are allowed to have those at your healthcare facility, but it has to be with limited size. And as I said, no saturated fat, no deep fried, and so on. The other thing, and I can't emphasize more about healthy marketing. Just give you an example from our days now. Our days now with the COVID, as you can see, the oneness all around the world. Everyone is speaking about the same thing. Everyone is talking about masks. Why? Because the marketing. See how the influence of marketing can change people's habits? Did you ever imagine yourself walking down the streets with a mask on? I never imagined myself doing that. But now it's the norm. If I'm not wearing a mask, this is actually something weird. So it's the same thing when it comes to healthy marketing. So if we work hand in hand together, and if we work on marketing our foods in a healthy way, then it can happen. So through, like, if some of you are from the media, some of you are from TV, from radio, or any kind of social media channels, please emphasize on the healthy marketing. As I showed you, La Brioche, for example, and other partners as well. They worked with us, they had them on their social media. So it's very, very important. When you go into a healthcare facility or even into restaurants, instead of having the picture of unhealthy food, have a similar picture to what we have here in the background, the fruits, the vegetables. Now, actually, last but not least, we developed, as I said, an food analysis program. This is the interface of it. I want to ask the people who are turning my slides, can you try to make it work, this video? Would it work, actually? Can you play it, please? Yeah.
Actually, the media is not available on the presentation. Sorry.
It's fine. It's this is available on DOH website, and of course we are partnered with them, Abu Dhabi Public Health Center. So if you want one-on-one training on how to use this site, on how to analyze your food, we are more than happy to do that for you. Thank you so much, and I hope that this was beneficial for all. And I'll be with you later. I'll be talking about the calories on the menu, but now I will leave the floor to my colleagues. And if you have any questions, we are there. This is our social media info. Please send us an email. Again, my name is Arwa Mudwahi, and I would be more than happy to support you with your Healthy Initiative programs. Thank you.
يعني I think نرجع نبعث reminder. Okay. Good morning, and thank you for attending this workshop. My name is Rawan Al-Mar'i, and I work in the nutrition section in Abu Dhabi Public Health Center. Today, I will be discussing in this presentation, I will be discussing the Waqaya for Groceries program. It's an initiative derived from Waqaya food specifications or Waqaya healthy menus. And I will be explaining on the process on how we can improve our healthier choices or buying healthier products with the help of the groceries and supermarkets. If I will just wait until the slides are up for Waqaya for Groceries. Okay. So the objective of the initiative, next slide, please. Okay, so the objective of the initiative or of the program is to apply effective and sustainable in-store marketing strategies that will allow people to actually choose healthier products in an easy fashion. This idea came to help promote the increase or to help increase people in choosing healthier food products rather than the regular food products or the processed food products as part of the, let's say, as part of the a healthier community, a healthier Abu Dhabi. The pilot phase is a 6-month period, and hopefully by 2021, it will be implemented in all supermarkets and groceries. Next slide. What is the importance of such a program? As you all know, and as has been discussed by my colleagues, we do have an increased rate of obesity and overweight, and our main goal here in the public health center is to actually try to decrease that through many programs related to nutrition and through improving physical activity and well-being of the community of the Emirates. In general, obesity is a global epidemic, so it's not only us, it's everywhere else, and you do see many other initiatives regarding healthier options in supermarkets being implemented or in the process of being implemented in other countries. Next slide. So, how does this work with you as a supermarket owner or as a grocery owner? It can be part of your corporate social responsibility, where your company voluntarily works to contribute for a healthier Abu Dhabi. Next. So, as explained by Dr. Arwa, Waqaya program, it allows restaurants, food outlets, food manufacturers to add the Waqaya logo to healthy and nutritious food consistent with the Waqaya food specifications that can be shared with you upon request. Next. So, how does this initiative for groceries work? Now, many big supermarkets or hypermarkets, they do contain delis, and where you prepare food, or you have, ready to eat or ready to serve food, people can actually come and just grab it and leave. So Wuqaya food specification or the Wuqaya logo can be applied to this. Okay. Now, for categories in the supermarket, what we try to do is we try to aim on highlighting the healthier options. Like, for example, in milk and dairy products, we highlight the low fat and skimmed products rather than the full fat, whether it's milk, cheese, yogurt, leban, anything else. For vegetables and fruits, anything that's fresh or frozen or doesn't have any kind of added syrup or added salt, sorry, or any preservatives or artificial flavoring. These are all considered to be accepted as healthier options and can have the Waqaya logo attached to them. In addition, any kind of nuts that are either raw or roasted without any kind of oil or salt are also accepted. Whole grain products such as whole grain bread, whole grain cereals, whole grain crackers. These are all a part of healthier options or healthier products rather than the regular products that people in general tend to choose. Next slide. So, how can this be implemented in a supermarket? Now, there are many strategies in which you can choose or which can take place. Like, for example, when you do some tastings for specific products, it can be easy that you choose the tasting of healthier items rather than the processed food or the unhealthier items. You can also coordinate with staff working in the groceries or in the supermarkets to actually assist the customers in giving a tour throughout the facility, highlighting the availability of the healthier items and where they can be found. Community events is also another option that can be chosen, where the nutrition classes, let's say nutrition awareness, healthier eating awareness programs, activities, anything like that can happen. And finally, it can be done through promotions and through coupons, where, instead of having those coupons or promotions for processed food, or let's say for chips or soft drinks or whatever, they can be given for healthier options, like, for example, discounts on fruits and vegetables, discounts on whole grain products, discounts on raw nuts. So these are some of the options or some of the ideas that can be implemented in any grocery or supermarket that will help people make a better choice. Next slide. Now, as for the layout, it is well known that those shelves that are at an eye level, they are the most selling products. So part of the in-store layout strategy that can be done, in the supermarket for Wuqaya for groceries, is to actually highlight the low-fat and skimmed options or the better, healthier products in the shelves that are easily accessible for the customers. You can increase the reach to healthier options by highlighting the healthier options through shelf labels. So the label can have the Wuqaya logo on it, on the whole shelf, and people will be able to easily understand that this logo means a healthier option, and it will be much more visually, let's say, attractive. So they can actually go and pick up the healthier products rather than, looking for them. So as I mentioned as well, stock healthier options in high traffic and high visibility areas. And also through checkouts, we can reduce the unhealthy or the chocolates and chips that are usually found on the checkouts by adding more better options or healthier options, such as nuts, raw bars, things like that. Next, please. This is an idea on what a healthier checkout can be. Instead of it being the sweets and candy that you can see everywhere, you can actually add some, individual fruits. You can add some milk, low-fat milk. You can add, shelf-life milk, of course, long-life milk. You can add some raw nuts. You can add some of the healthy snacks that are fulfilled within the Wuqaya food specifications, and all of the details are actually found in that document. Next. So one of our pioneers was with Lulu Hypermarket in the WTC World Trade Center branch in Abu Dhabi. They actually did this implementation process, and it was actually quite a success. Where, as you can see in those photos, you can see that the ones with the healthier options were the ones that had the logo on them. So this was part of the promotion of the Wuqaya for Groceries initiative, and hopefully after this presentation, many more will be interested in joining this program. Next slide. So, as I mentioned earlier, we do hope that by beginning of 2021, there will be some kind of a mandate, hopefully, or there will be an increase in the interest in joining this program, because it's just an idea of reshuffling of the products in supermarkets, just to help people and to help, your corporate social responsibility, and to also help improve the well-being and the health of the community of Abu Dhabi. Next slide. For any information, please feel free to contact myself or my colleague for any questions regarding this, and we will be more than happy to assist you with it. Thank you.
Hello, everyone. It's me again, and thank you, Rowan, for speaking about healthy groceries. We talked about Wuqaya for groceries, and now I would like to speak to you about calories on the menu. If you missed the first lecture that I gave, it was about adding Wuqaya to food. And just a quick introduction again, I'm from Abu Dhabi Public Health Center. My name is Arwan Udwahi. I'm a physician by training, and I have a Master of Public Health and Nutrition from UC Berkeley. And I've been working since 2008 for the Department of Health, and now with the Abu Dhabi Public Health Center that it started last year, 2019. So please, can we start with the presentation? Okay, so great. Now we're going to speak about calories on the menu. What is calories on the menu, and how did it start? This is actually part of fighting obesity and fighting diabetes. It is one of the pillars is actually to know your calories, to know how much you're eating, what is in your food. And Wuqaya, it covers much more than calories. It covers the fat, it covers the sugar, it covers the salt, as I explained earlier. But actually, calories, covers the amount of, I would say, like the amount of calories, the amount of energy that your body is consuming. Now, each one of us needs certain amount of energy. It differs from person to person, depending on their height, depending on their weight, and depending on their gender. Like if you're a male or a female, it's different. Of course, if you're a teenager and you're highly active, physically active, then definitely you need much more calories than, let's say, a female who is not physically active. Someone at my age, which I'm going to keep discreet, is actually needs much less calorie than someone who is younger. So it really differs. But so it's very important for you to know how much you need. And based on that, when you go to a restaurant, when you open the menu, when you know what you want to eat, then actually you know how many calories you need. And as I mentioned, it is all this we're doing to combat the major burden of diseases in Abu Dhabi. As I said, it could be any non-communicable disease, diabetes, dyslipidemia, hypertension, obesity, All of those are non-communicable diseases that you don't contract from a virus, or you contract from seeing someone who has it. It's not contagious, but it's a chronic condition that you live all your life with it. And the only way that you can cope with those life conditions is long-term life conditions is by having a healthy lifestyle. And when it comes to healthy eating, it comes to exercise and many other healthy habits that you can manage to keep yourself well and healthy. Next slide, please. Okay, so now what is, can we go on for the, now we're going to see what is the goal of this and what are the objectives of it. Now, the goal is that we ask the restaurants, chain restaurants, cafes, food outlets in the Emirate of Abu Dhabi to add the calories to ready-to-eat meals. And this is, as I said, to help people to make a healthier choice. And the implementation of a pilot phase, like as I mentioned earlier, if you attended my Wiqaya lecture, we cannot do anything without monitoring, without evaluating it. So usually what we do, we have a first stage where we pilot our work. We do a pilot program for a few months, few weeks, and then based on the results, we either continue or we do some changes, some modifications, and we continue, but we don't stop. So if we go back to the previous slides, yeah. So the objective is actually that we're going to do a pilot phase. We hope that some of you who are attending today or who will see this lecture because it's going to be available on YouTube, that you will be part of this pilot. And it is very important that the caloric information is covered, and it says like per serving, because someone like for a lay-paced person, if he goes to a restaurant or if he goes to a cafe, he probably wouldn't know if you put like let's say for the like the whole meal or the whole everything, how many calories. He needs to know how much he's eating at this time, and I'll show you examples in a second. So what is the operating model? If you are a restaurant, if you are a food outlet, you need to disclose your calories for the standard menu items. What do I mean by standard menu items? Because there are items that are interchangeable, that they keep changing. You do them on a daily basis, you do specials. You cannot have calories for those, and it's not required. But it's very much required for those items who are standard menu items. And also if they are on display, self-service, all of those, if they are standard, like let's say every day you have the same salads displayed in a buffet, for example. Every day you have the same sandwiches displayed in your fridge. Those definitely must have the calories because you already know what's in it and you can measure what's in it and you can add it to it. So it's very, very important that you have it. And also you need to, people, because as I said, not everyone will know how much they need. I mentioned earlier that it differs by person, it differs by weight, it differs by sex, and it differs actually by their energy level. But we can say that we can round it up to 2,000 calories, give or take. That's in general. And this is very important that you have this information available because someone, if he doesn't know, 1,000 calories wouldn't mean anything to him. But if he knows that the maximum he can reach is 2,000, and it could be less than that, especially if they are eager to lose weight, then they will know if they see a meal that's 1,500 calories, that this is a lot. And also you need to have additional information needs to be available, and everything needs to be written actually. I'm not gonna take you into much detail, but once you register with us, this is our flow chart. This is what you need to do. We take you through that tree and we let you know that if you already have the calories, what you do. If you don't have them, what you do, how to register, how to analyze your food, how to train your staff. And then we have agreement between us and you. And after that, there will be monitoring and there will be a certificate that's issued. And the same actually that I mentioned earlier, that there is a site where you can analyze the food. The same site you can actually use for analyzing the calories as well. So the establishment, if you are a chain restaurant, it's a must. If you are a quick service buffet, also. You can do it at groceries, convenience stores, and also for takeouts, even in cinemas, in parks, you need to add the calories on the menu. Coffee shops, superstores, all of those, all those establishments are covered under that initiative. I promised to show you what I meant by adding your calories. Here, look at those 3 examples. Those are fast food restaurants. Now, if you look at it combined, and I said you can't have more than 2,000 calories a day. So if you go and grab a quick lunch, not the real lunch, you might want to have lunch later with the family at home, you want to have dinner, you already had your breakfast. If you go to one of those restaurants, you can reach up to 1,500 calories. But if you know the calorie in each item, then you can omit some items. Like let's say, okay, you're craving a burger. There's nothing wrong to have one every once in a while if it's like scattered, not something that's a routine daily. Something that you have, let's say, less than once a month. Then yes, you can have it. But make sure that you don't add the fries, you don't add the ice cream, you don't add the shake, you don't add the drink, because all of this, look at this drink in the last one, it's around 410 calories. So you definitely don't want to add those extra calories. No need to add them. And that is the biggest importance, and this is the biggest plus of having the calories added. Now, this is actually, I was in the States visiting last year, and that's where I come from, not by origin, but I've lived there for many years, and I go every summer. And I was impressed by the way Californians do their calories on the menu. And as you can see here, those are from several restaurants that I visited. They are from a Cheesecake Factory to BF Chang, and the other two also are chain restaurants. And as you can see here, every single item has its calorie on it. And they started this program years ago. They started it in 2006, I think, 2007, and they kept expanding until now it's everywhere. When I was there 10 years ago, it was only here and there. Now it's everywhere. You can't find a menu, you can't find a board, you can't find any food item that doesn't tell you how many calories or how much energy you will be consuming. I'll give you an example from one of the restaurants. I was there, and this was years ago actually, and they had two chicken dishes. One chicken dish that had apricots in it, and the other one that had bechamel sauce. Usually when we have audience, I do this little game with them. Then I ask them like, how many calories you think is in this and how many calories in that. In the one that has the sauce, the bechamel sauce, and when I read the calories, I was about to order it. It was like around 1,700 calories versus the one with the apricot. It was only 450 calories. So can you see the difference? It is a huge difference, actually. So definitely, you're going to have chicken. We'll have it the healthy way, at least, with the less calories. This is when you go, and this is from Pete's coffee shop. Here, as again, you can see everything is labeled, even the cake. Like if you want to buy a cake, it tells you per portion, how many servings, first of all. And this is what you need to do in your establishment. You have a cake. Okay, how many people is this cake serving? You need to tell them. This is, as I mentioned, you need to tell them per serving. Like if you tell them per whole cake, this is like 10,000 calories. It doesn't mean anything. You need to tell them that per portion. And I give you an example of dangerous cakes, like let's say cheesecake. It can reach up to 700 calories, believe it or not, for one person, one slice of cake. This is from a big store, Costco, if you've heard about it. And even that store, while you grab and go, it will have the calories on it. And everything from the ice cream, from the pizza, and also it tells you how many calories in the whole pizza, if you want to order a whole for your whole family or if you want to get a slice for yourself. The one on the right is from a coffee shop. Even the espresso has the calories. So if you were watching your weight, you probably, when you see how many calories in those drinks that have the sugar and the chocolate and so on, and you see that it can reach 400, 500 calories, you will definitely opt out from it and go for the espresso, who has close to 0 calories, without sugar, of course. So there are exempted foods and there are covered foods. As I mentioned, the exempted food can be the temporary items, the daily special, the condiments. Like we're not going to add calories to our like spices, for example. This is not a must. And the foods that are not on the menu or the menu board, of course, then it's not on the menu. You're not going to add it, even though if you were planning to serve it. Like some customers, I know if you're a restaurant owner, then you will know for sure that some customers will tell you, I want this item, especially if you are a fine restaurant, even if it's not on the menu. In that case, you're not required to have. Even if you are one of the establishment that signed a contract to have the calories, in that case, you don't need to have it. So the other thing, actually, now, what are the next steps? The next steps, it's very, very important, communication and communication. For customers, that you make sure that you advertise for your project. Please attend our workshops. As I mentioned, for Wiqaya, we do 2 to 3 workshops a year for calories as well, and also use our program to calculate how many calories. So we made it easy for you. We have a program that's available. It will come to us with how many calories, and it will show us that you are actually calculating your calorie. And enforce it in your establishment, and there will be future regulations coming up. Please watch out for those. Watch out for all government regulations. We're not the only ones working on that. We have our partners from Quality Conformity Council. We have our partners from the other authorities, and there is also ESMA, the Emergency Standardization for Metrology and Authority. All of those have their own regulations, so it's very, very important for new establishments to keep up to date with the regulations, because at the end of the day, it is for the best of you, for your benefit, and it is for the benefit of the Emirate of Abu Dhabi and for the people who we care much about their health and about their wellness. So that's it from my side for today, and I hope that you benefited from those 2 lectures, from the Wiqaya and from the calories on the menu. Again, if you have any questions, please don't hesitate to contact us. We are here to support you and help you out with those 2 programs and other programs as well. I'm going to leave the floor now to my colleague Rawan Murray, and she will be talking to you about reducing salt in bread. Thank you.
Hello again. So this final session, I will be talking about one of the other programs, or one of the main programs that we are working on how to reduce salt in bread. In general, this is a federal initiative by the Ministry of Health and Prevention. So it is our duty, not only as the Emirate of Abu Dhabi, but also for all the United Arab Emirates, to help with this initiative, where the main target is to reduce salt in bread. Okay. So this will be the agenda. I will be explaining on the consequences of high salt consumption, what is the recommendation for salt reduction, specifications, how is it done, some examples or some regional examples, and then what will the implementation plan look like. So, as I mentioned earlier, this is a federal initiative. The specifications that came up, they were based from international standards. Food standards are normally focused on the quality and the safety, where community health specifications, they focus on strategy key drivers that will help prevent non-communicable disease, such as high blood pressure, diabetes, obesity, and such things. Now, a part of the community health specifications is on how to reduce salt in bread. Why specifically bread? Because I believe that even if you look like in the United Arab Emirates, it is the most product that is usually consumed in the community. So what is the problem with sodium or salt? When you consume too much salt or sodium, it increases the blood pressure, it increases the risk of stroke, and it also affects the healthcare costs, the general healthcare costs. Why is salt used in many products, such as bread and other things? Because it has a very long shelf life. It is considered as a preservative, and it is an enhancement to taste of products, of most of the products. Next slide. what is the recommendation? The international guidelines recommend that salt or sodium to be reduced to 2,300 milligrams per day, which is around 1 teaspoon, and even reduce it to 1,500 for those above the age of 51, or in case of history of high blood pressure, or if they are diagnosed as high blood pressure. Now, what is also the recommendation? It's also to conduct consumer surveys regarding the knowledge about the importance of salt reduction. And caterers should be targeted as part of a general educated campaign for the same reason. Okay. So, as I mentioned earlier, when you increase your salt intake, you increase your blood pressure and you increase your risk of stroke. So less salt means lower blood pressure and less risk of stroke. Next slide. Reducing it by 5 to less than 5 grams, or let's say 1 teaspoon per day, will actually help save 2.5 million lives every year. And this information, or this target, was actually given by the World Health Organization. So just a slight reduction in your daily intake will actually help a very large, or will actually make a very huge difference per year. Next. So, what are the specifications for healthy bread? It should be mostly whole grain, at least 25%, with 5 grams per 100 grams fiber, less than 1% from naturally occurring trans fat, so it shouldn't contain any added trans fat, and less than 7 grams per 100 gram total sugar. Less than 7 grams per 100 gram of fat, and less than 5 grams of sugar per 100 grams. The specifications are much easier to comprehend or to understand when they are done per 100 grams, since mostly bread or other products are usually mass-produced. So, as for the sodium, it should be less than 394 milligrams per 100 grams, or 0.98 grams of salt per 100 grams of product. There is a difference between salt and sodium. So when calculations are done, or when analysis are done, it is very important for you to focus on what is it that was measured. So let's say the translation of what I just mentioned is that there should be at least 5 grams or 1 teaspoon per 1 kilogram of flour. How can it be done? Salt reduction needs to be done on a gradual basis so that consumers do not complain, or there isn't a lot of, let's say, rejection to this idea. It needs to be done gradually for the community to adjust to the change in the taste, because the taste may change. Marketing campaigns need to be done to inform the people, or to inform the community of the reasons behind it, such as I just explained it. And the changes in bread production for quality control, such as some replacements or some changes can be made, where, for example, replace some of the salt in the recipe with potassium chloride, or with potassium salt. Instead of using sodium chloride, you can use potassium chloride, because that doesn't increase blood pressure as sodium chloride. Decrease the amount of yeast used, because yeast requires salt and sugar to to properly work. Use different preservatives to control the mold, such as vinegar, and control the rest and proof time of the dough, since salt would help. So reducing salt may affect that time, and it's just a matter of trial and error for you to figure out the best way for you to keep the taste and the taste of your product as a bakery. Next slide. So how can these be done? Let's say if by 2020 target, this is from the Ministry of Health. So by reducing it gradually, okay, the target, let's say in 2021, per 100 grams was 1.1 grams of salt. And then by next year. Okay, I apologize. I apologize for this. So as I mentioned, for incremental salt targets is by the end of the fourth year, there will be a reduction in salt will be 0.5 grams per 100 grams. That is the target of the Ministry of Health and hopefully for all of the Emirates. Next slide. Okay. This is a table that shows the average consumption of salt in Abu Dhabi and what is the target reduction that we are hoping that we will be able to reach. So let's say, for example, for whole wheat bread, our target is to decrease the salt by 25% since the average, as mentioned earlier, is 399 milligrams of sodium per 100 grams. So that will be a 25% reduction from the average salt found right now in the bread products. And also you will see other examples such as French bread and sandwiches. In general, the reductions can be ranging anything between 25 to 45%. Next slide. Now, regional examples in Bahrain, Oman, Kuwait, and Qatar, they did actually reduce their salt in their bread products to 0.5 grams per 100 grams. And in Saudi Arabia, it is 1 gram of salt per 100 gram in the final product. So this is an initiative that's not only in our country, it's also all over the world, and it's also in the regional areas. Next. The implementation plan, as discussed, within this year, we were hoping that, or let's say by the end of next year, we were hoping that we will be able to start with the implementation and the testing of the products and their gradual reduction for the 4-year plan that was discussed earlier. And also, hopefully, we'll be able to process the assessment evaluation of that. So, if you have any questions, you can feel free to contact us through our emails or our phone numbers, and we'll be able to assist you with that. There will be other meetings regarding the salt reduction and all of that. So thank you for attending, and hopefully this has given you enough information for you to be able to understand the programs that we are doing here in our section. Ms. Mariam Al-Mansouri, right now, she will be just finishing off our workshop. So thank you so much.
Thank you, Rawan. Thank you, Dr. Arwa Al-Madwahi, for your great workshops and great presentations. Again, we would like to thank CL team as Abu Dhabi Public Healthcare Center. We would like to thank all our audience attendees and please enjoy SIAL, and all our workshops will be recorded for 4 days ahead. Please do not hesitate if you need any further information, and if you need support, we are always here to support you. Thank you and have a pleasant day.